In the second part of the conference, we will be discussing the medical aspects of manned space travel, the challenges, the innovations, the science behind it all. Shir, you with us? Yes, the person that will lead this section is Dr. Shir Stibbe, pediatric resident at Sheba Medical Center, an AX-1 mission specialist, backup astronaut who had been in Houston, Texas for the NASA, SpaceX, and payload training. During this period, Shir also completed the Principles of Aviation and Space Medicine course at UTMB University. Shir, the floor is yours.
So good evening, everyone. I am very excited that this evening is happening. We have been talking about it, I think, before the mission flew up to the space station, and having all of you guys here makes me so happy. So thank you very much for being here. I want to share with you that as a pediatrician, resident in Sheba Hospital, on a daily basis, I do encounter problems we still do not know how to solve. So having a number of clinical experiments or human experiments on this mission was very significant for me. We will start this part with, now I'll take my text. We have Dr. Michelle Hong Chan. Michelle is a dear friend and an MD and a PharmD. She received her Doctor of Pharmacy at the University of Texas and her Doctor of Medicine at the University of Texas Health Science Center McGovern Medical School. She completed a residency in emergency medicine at Baylor College of Medicine and a second residency in aerospace medicine at the University of Texas Medical Branch in Galveston, Texas. She is currently a mission flight surgeon with Axiom Space. Michelle. So I had the privilege to be a patient of Michelle as an astro in training, because part of what you do is prepare us for the flight. So it wasn't only you guys that got her. And I think maybe to start this panel, it would be good if you could give us a short intro of what does it mean to be a flight surgeon?
So that's actually sometimes a very difficult question to answer, what it means to be a flight surgeon. First and foremost, it means taking care of the astronauts that go to space. And that starts from the second that they decide that they want to go to space. Part of that's with the selection process. Part of that is certifying them medically to make sure that they're as healthy as possible. And then we work hard to do, kind of treat them like professional athletes so that they can be optimized in their health so that they're at their best performance shape when they're on mission. Then, of course, we take care of them during mission. And as they come back, there's also readaptation. But that's only a small part, actually, of what I do as a flight surgeon, which is kind of amazing to me. So there's also operational medicine that we do in terms of manning console and helping understanding some of the parts that as it relates to how the human interacts with the mission itself and making sure the mission is successful.
I want to interrupt just and say that manning console is a short phrase of a big thing, of actually being the contact on Earth for the astronauts and being their person, their go-to person when they feel bad, when they feel sad, or whenever they do need help and can't help themselves. Imagine yourself going on a long trip to an unknown place, having someone to navigate you between all the mess and knowing how to make you feel better and feel comfortable to fulfill all you heard about that was built for the short time, so many things to do. That's very meaningful.
I'm glad you feel that way. Sometimes I forget that you were one of my patients. Yeah, so there's the operational aspect. We also get to provide some technical support and expertise to the engineers, and that's something that's a bit of a learning curve for me. I don't have an engineering background, and learning how to speak their language and answer their questions that make them happy, but still help them understand how important it is to take care of the human, not that they don't understand that, is something really special. And the last part that I really enjoy is also getting to do some of the research aspect, much like we're seeing during this conference, and I think throughout this week, hearing about the science and how it really advances what we can do in the future. Those are very exciting parts of what I get to do.
Thank you. You said at the beginning that a big part is getting them prepared as special athletes to be on their best show on time. I think this is especially important in missions like these and for the future of space, where you actually, as a physician, in opposed to the NASA missions, you just get a given team. They were awesome, 4 rock stars, super, but still a given team that you need to actually represent in front of international boards, that they are qualified and that they won't risk the whole operation that's in the space station. So I think that's a very big part of this being a first mission of a kind. How was that?
Yeah, that's a really good point. So traditionally, we think of aerospace medicine as taking these really well-selected, extremely healthy, extremely fit people and taking them into space. And that's held true so far. But now, as we're commercializing low Earth orbit and trying to expand space for everybody, we realize that that's not going to be the regular population that goes up there, and we don't want that to be the population, right? We want to make this as accessible as getting on a commercial airplane. And that being said, people are going to have some sort of medical problems, whether it's something as simple as high blood pressure or high cholesterol, to maybe some things that are more severe. And we might not think it as severe down on Earth, but could have some major consequences in space. So something as simple as, we think of it simple now as diabetes, might not be that simple to manage in space. So screening and selection is very important. I think something that's unique now, especially in these private astronaut missions, is we have the opportunity to say yes to everybody. We don't want to disqualify anybody from flight. And so part of it is understanding their medical background and doing a very extensive screening process, not to say no, but so that we understand and can quantify what the risks are so we can prepare better and make sure that we have medications and plans in place to help protect the human and make sure that the mission is successful.
Yeah, absolutely. This is, you know, you were talking about planning, taking part in a space mission, doesn't matter if it's medical or not, planning A and plan B, and having a plan C and a plan D for every scenario. And I was wondering, on AX1, did you have any unexpected events that made you change your plans or even surprised you guys?
Well, not to get into much of the medical privacy of any of our crew.
Names.
However, you know, what surprised me actually was that we had all these plans, and the reason we have these plans in place is really something called Murphy's Law. The more you overplan, hopefully the less likely you have to use any of it. And I would say that held very true for the AX1 crew. They did phenomenally well, not only with adaptation into space, but also adaptation when they came back. So much so that I think Larry was doing yoga poses within a day or two of coming back, and even though I was trying to stop him from himself, it really wasn't necessary. I think what surprised me was some of the other aspects that you don't always think about as a doctor and someone, and it's a point to what we do operationally, is at one point in time, while they were doing experiments, it was realized that one of the payloads didn't have the correct needle that they thought was supposed to be in there. And so it's not very often that medicine or a doctor can help save a little bit of science, but we were able to find something within our medical kit that would substitute and serve so we could keep going. And so that was an exciting part that was unexpected that I did not plan for in the mission.
Amazing. I think also the fact, like you said, about diabetes, the fact that people with a wider range will fly will also expand very much the science that we can produce from these flights. Thinking a little bit forward about the future of space medicine, do you have a vision? Because I feel like it's going to be totally different.
So there's probably like a 5-year vision, a 10-year vision, a 20-year vision, a 100-year vision of what can happen in space. I think if we look long term, I think that there's opportunities for unique medical clinics in space that could offer certain rehabilitation or therapies that you just could not get on Earth. And then something that excites me that I think is actually closer to becoming a reality is potentially the 3D printing of organs. So these tissues are so fragile, it's not something that we can do on Earth in 1G, but in zero gravity or microgravity, there is a possibility of printing these fragile tissues. And then imagining that you're taking it from the individual's own stem cells, and then using that to create the organ, we could potentially even eliminate the idea of organ rejection or graft versus host disease. And that's something that I can't imagine how much that would change the world.
Amen to that. I think a big part of maybe the pioneering of space medicine was telemedicine, long time before COVID was here and we could see our physician through the TV and show him our son's ear or other problems. And actually we have a researcher here in the crowd, Dr. Rabin, that sent with us a device. Hila's a neurologist, and she sent a device to help better telemedicine for I think it will be very relevant for the long duration flights, to have more and more health data about the astronauts. Hila, I don't see where you are with this.
Hi.
Hi, good evening.
Good evening, Hila, founder and CEO of Stroke Alert. What we do, we monitor, detect, and alert stroke here on Earth. So stroke is the most disabling factor today on Earth. When we did the space mission, what we found that even during a short flight, there was some flow changes. Now, with longer duration, I'm going to ask you, what will be the implications of such monitoring and telemedicine through space?
That's a tough question. Well, I think there's a couple parts to that. One is, like I mentioned earlier, we're going to see people that are going to either have a higher propensity for stroke, or just by sending more people out there for a longer period of time, sadly enough, it's bound to happen. It might not happen in the next year or two. It might not happen the next decade, but we'll see something like that. And to have the capability to monitor early on, and maybe stroke is one of those things, and for any of you guys familiar with some of the acronyms, at least in the US, we use the acronym FAST. And it just shows that time is brain. And so the faster you recognize it, the faster you do something about it, the more you can help the patient and potentially save a mission, definitely save the patient from debilitating effects long term. So being able to monitor that in real time, or even in a rapid manner, and deploying medications would be invaluable. In the short term, it could help us decide what type of medications we want to spend. And then one more aspect about that is we're talking about going from 1G to 0G on these missions, and that changes the blood flow. But what happens when you go to the moon and you're changing the gravity once again, and it's not quite 1G, but it's not microgravity, and then you go again further, maybe to Mars? That could have ramifications on maybe the risk of stroke in individuals.
Thank you. So thank you very much for this talk. I can talk with you for hours, and I'm so happy you're here for this week.
Likewise.
And I wish you a good Israeli Space Week. That will be it for our conversation this evening.
Thank you. Thank you for having me.
To continue this part of the evening, I would like to invite some more speakers. And I'll take my pages again. So I would like to invite to the stage 5 talented representatives of a few of our researches. We had many more, and this night is way too short for everything I want to hear. But we'll start with what we have. I would like to invite David Burstein from CRISPR Experiment. David is a senior lecturer in the Shmuni School of Biomedicine and Cancer Research at the Faculty of Life Science at the Tel Aviv University. Second guest will be Dr. Gal Antman, who is leading the experiment called the Eye in Space. Gal is an ophthalmology resident at Rabin Medical Center. At the same time, he's a postdoc fellow in eye disease and innovation in ophthalmology at Mount Sinai Health System in New York. Our third speaker would be Dr. Harel Baris from the Sheba Arc Space Innovation Center. He's a physician at the ARC, the Innovation Center of Sheba Medical Center, leading the ARC Space Lab. Next guest would be Yair Levy. Yair is a co-founder and CEO of the startup called Brain.space. Brain.space, I'll tell a little bit about it, a sentence, please, go on. Brain.space is on a mission to make brain data accessible for everyone, enabling researchers, companies, and even astronauts to accelerate innovation with accessible, accurate, real-time, reliable brain data and actionable brain insights. And he will explain soon what does that all mean. And last but surely not least, we have Dr. Efrat Baron Harlev. Dr. Efrat will be here as she's the CEO of Schneider Children Medical Center since 2020. She's a medical doctor graduate of the Ben Gurion University. She completed her pediatric graduate at the Ben Gurion University, her pediatric residency and pediatric critical care fellowship in Schneider, mastered in public health administration at Harvard University, and on top of all that, she's a leader in accessible pediatric care not only in the hospital but also in Israel's outskirts and beyond. Wow, okay. So I'm very happy to have you all here. We have half an hour, and we're going to talk about so many interesting things. I would like just to start with a short scope. If each one of you will take a short round, can say what's your experiment or who are you presenting here, and maybe what was the incentive of your project or your space project.
Okay, I tried. I'm Gal Antman. I'm from Rabin Medical Center, and we did research under the wings of Professor Irit Bachar and Dr. Orly Galor. And what we wanted to accomplish is basically there is a space-associated neuro-ocular syndrome, which is basically an eye disease that astronauts have after long space flights. And we were lucky enough to use a new imaging device that is out in the market today that hasn't been used. And we thought that the vascular blood flow has a possible contribution to this disease, and we were the first to use it in space, before and after space.
Cool. I'm David from Tel Aviv University. I represent a joint group from Volcani, in the Pines lab and my own lab, and we were working on a project to do genetic diagnostics with a new system. Think about a PCR diagnostic, but as simple as portable as an antigen test. And we were working on it before there was this wonderful opportunity, and we wonder whether we can use it in order to diagnose disease in space. So that was our mission.
Hi, a pleasure to be here. I'm a physician at ARC, the Innovation Center of the Sheba Medical Center, where we envision how to shape the future of health on Earth and beyond. And in our ARC Space Lab, we think and vision ways to harness the opportunities of new space to advance healthcare innovation. And I was fortunate not only to lead the 6 clinical studies of our medical center, but to be the foots on the ground for many of the other investigators. And I had an amazing experience trying to problem solve many of the challenges of actually conducting the studies throughout the mission, either before and after.
Sometimes small tasks like first void after splashdown is impossible, and without having someone there to decide it's going to happen, no matter what, it's impossible.
And even finding some tubes during tornadoes where Amazon Prime is closed, tough luck. It was an amazing experience.
Thank you,
throughout.
So I would like to say I'm honored to be part of this panel and sharing the Brain.space perspective on the Rakia Mission. And I will elaborate a bit to give you the content. So Brain.space is the brain data company. And we make neuroscience accessible for everyone, and actually everywhere, even in space. And we enable organizations and companies to collect, analyze, and use brain data to enhance research, product development, and hyper-personalized treatment and services. In this experiment, we work together with the Ben-Gurion University, Owen Shriki Labs. He's here in the audience, I believe. And what the experiment goals were, well, during space missions, astronauts are being monitored for every tissue. In they continuously being measured for the heart rate, blood pressure, for body temperature, but there is one tissue which is not measured, which is not monitored, which is the brain. And why is that? Because it's so complicated. You cannot send an MRI machine up to the space. And believe you looked at the travel list, there is no EEG technician there.
No, and putting the EEG with all the glue on your head when you have no shampoo and running water, that's just a big no-no.
And it's take back an hour. So if you're familiar with that, it's a very challenging task. Even here on Earth, not to mention up in the International Space Station. And this is where the Brain.space come into play. We provide our brain sensei. It's a brain gear that can be easily, in a few minutes, can do the exam that takes hours on ground. And the goal, of course, is to provide ongoing monitoring along the mission. And we thank the astronaut to participate in that.
Thank you, Yair.
So at Schneider, we say that children are above and beyond. What does it mean? Children are above and beyond any kind of action that we are doing because we want them to be well. Children are above and beyond because they're the future. Children are above and beyond gender, race, politics. They're above and beyond everything. And when we take care of children, we believe that we should not only take care of their disease, but rather look at them as children. So when I first heard on the news about Eitan's flight and about the mission of educating children, I said, educating children above and beyond, Schneider must be there. And so when we decided to send our mission to space, it was obvious that it wasn't going to be just the hospital's mission, but rather the hospital with children. So in a little while, you will be able to hear about this project that we've made about cancer cells in zero gravity. But we did that with the children of the hospital so that we can empower our own patients, so that we can educate them, but also learn from them what does it mean to be a child with cancer, that looking at her own cells or something very familiar to her own cells. So in a second you will hear about that, above and beyond.
Thank you, Efrat. This is a truly inspiring story. And beyond the personal inspiring story, I think each researcher can relate that his dream would be having an enthusiast researcher in his lab that is very interested in the disease, in the mechanism, and also in healing. And I think that this is maybe the best example possible. So we have with us here a lovely girl named Michal Khan. Michal, she recovered from leukemia, and she was treated in Schneider Children's Hospital. Hi, Michal. Michal will tell us a little bit. Beyond what I said, which is a big part, but only part of her story, she took part in her in the high school final project in biology, and she took part in this research for quite a while with Dr. Diti Birger.
And the teacher, Shai, who is also here,
right.
because we have a school at our hospital as well. And just one word about Michal. So she's our patient, she's our student, and she's our pride, because she's the first one who was all three of them, but she's just the first, as this was a first for you, Eitan.
Michal. The mic is not working. Can someone help that?
Thank you so much. Thank you for the warm introduction. It was incredibly healing and emotionally valuable to participate in this experiment in collaboration with Schneider Children's Hospital, which I'm so grateful for, about leukemia, which I had finished treatment for in 2020. And exactly a year later, I had the rare opportunity to join the preparations of an experiment that I later watched being launched to space. The experiment checked how microgravity influenced the mortality rates of leukemia lymphatic stem cells in order to better understand the chemical cell pathways that lead to cell death known as apoptosis. This could potentially assist in creating less toxic cancer treatments and less harmful side effects for chemo patients. I'm very thankful to Rakia Mission for this once-in-a-lifetime opportunity.
So really just one more word. I'm an ICU physician, so I understood maybe 3 words of what she just said. But seriously, for us, patient empowerment, because children are so smart, so strong, is part of what we learn from them and then what we teach them. So this is part of the Schneider spirit. And thank you for being able to have that experience with Rakia. Thank you so much.
Thank you, Michal. Thank you, Efrat. I think beyond the educational part and the healing part of this project, it was true science, and real conclusions and real learning can be done from it. So that's a divine combination I wish all experiments could include. Thank you. Okay. We have a high standard. So we will continue. We're jumping to the other side. Dr. Gal Antman, the eye in space. Tell us a little bit. You know what? Before you start, I'm sorry I'm interrupting. We have an opportunity to hear a few words about visual changes during spaceflight. That's a problem that has been widely researched, and we still have a lot of questions that are left open, and maybe Gal can help answer some of them. And if I may ask MLA for a little bit of his experience.
Sure. Thank you. Well, first of all, I want to both thank and congratulate all of the investigators on the stage. Your contributions to the Rakia mission were obviously very important, and I think we surprised, as Larry said a bit earlier, a lot of people by the importance and the legitimacy, if you will, of the science that we conducted for a private astronaut mission, so thank you for that. So my experience with this, as you described, SANS, space-associated neuroocular syndrome, used to be called something different when we thought it had to do with interocular pressure or intracranial pressure. But it started my previous mission. I was a pilot, so I was farsighted, and I was age 48, so my arms were starting to get a little bit too short. And so I was wearing reading glasses, and I launched on the Soyuz capsule which is very small, and so the panels, the screens are very close. And so I had a prescription of contact lenses that was sort of extra strong, maybe a half a diopter or more stronger plus, so that I could read the screens as they were close. And the plan was that when I got on board ISS, I would take those out and put on my regular contacts so I could go about my business. And what I found is that when I did that, things were a bit blurry, and ended up flying the entire mission with stronger contact lenses. And this is about the time when we understood that this was an issue. It was never really known at NASA because it generally only affected long duration flights, and we had mostly been flying the shuttle, of course, which are 2 weeks at the most, so we didn't really know much about it. But at this point, people were starting to pay attention. So when I came back, I had a full investigation, and you can maybe describe some of these symptoms I had, but or not symptoms, but diagnosis. I had something called cotton wool spots. I had choroidal folds. I had some edema of the optic nerve. But most importantly, I had a farsighted shift, a hyperoptic shift of about, depending on the eye, a diopter and a half, which for a 7-month mission is probably more than, you know, the rate that your arms get shorter. Anyway, all the other stuff resolved quickly within a week or two, but the vision changes stayed, and I just wear stronger contacts.
Thank you, Mike.
Oh, that's a lot to take in for me.
You don't need to interpret all the symptoms.
No, but I think I'll speak about some of what you experienced was in long duration space flights, and actually, because this space flight was much shorter, we wanted to see if we can diagnose or even to use some of the imaging devices that we had on a shorter flight to maybe foresee if they contribute to the long space flights as risk factors. So what we did is basically use the multimodal imaging, and we had, I will speak only on one modality, which is the OCTA. And before talking about the results, I want to thank everybody in my team that took part of it. It's not working. We need another. Oh, got it. Okay, so OCT stands for Ocular Coherence Tomography, which is an imaging device of the eye. It pretty much uses, just like ultrasound uses sound, that sound travels, hits the tissue, go back to the device, and then it is being analyzed, and you can see a picture. So here, it's the technology uses light. Light is emitted from the device, hits the eye, comes back to the device, and then we have an image. Now, this device actually, no, we have some technical problems.
Lucky we are not in space now.
Yeah.
Chrissy, we need you.
Okay, so here, I'll just continue pressing the green, hoping something good will happen. So basically, this technology, we take different images only a few milliseconds apart, and every change in the tissue is translated into movement. Okay? No.
Go on without it. You can do it.
I'll just try the other one. Kim. Oh, yeah, the other green. And every change is basically translated into blood flow, okay? And what we have different layers in the retina and the choroid. This is the posterior part of the eye. We have different plexi of vessels, and we can image each and every one of them. So what we did here, this is the imaging of our participant, of Eitan. And on the left, you see the tissue itself. In the middle, together with the engineering college of FECA in Ramat Gan, we were able to do image analysis, and all the yellow dots are basically the movements, which are basically the blood flows. So we compared the pre and post-flight. Here you can see the upper one is the pre and then the post-flight. And the results were that we were able to show a larger thickness of the diameters of the vessels in the choroid, And here you can see another image of, it's called enfas, when you basically look at the deeper structures from above. So the vessels themselves changed, the structure itself, the choroid was thicker. And here we did like a heat map of the choroid and the retina. And on the left is the right eye, and on the other side is the left eye. And this is the retina and the choroid, and we were able to show that there is a difference in the retina of, in the right eye, 8.5% reduction, and in the left eye, 6.5% reduction in the blood flow. And what's more interesting is in the right eye, we had almost 30% reduction in the blood flow, and on the left eye, 11% reduction, and this was all statistically significant.
That's many words that I think we can interpret it as something very significant for a researcher.
Yes.
And for whoever doesn't understand the statistical significance, but I think you actually got very, very accurate data due to very high will of the astronauts to go through long and special tests that haven't been done before at this timing, before and after.
Exactly. And Eitan was extremely patient. We had him for over 5 hours per session, and it wasn't easy, specifically when he got back from space, and it was hard, but we were able, thanks to his much patience, to do everything. And these are the conclusions, and we were, just like you said, it's the first time anybody did imaging of the OCT angiography, and we found some major differences that are worth, this is n equals 1, it's worth continuing researching on more patients, more astronauts in the future.
Well, I think in about 50 years of human spaceflight, there have been more or less 600 people in space, so all researchers have n, like a very small n to rely on, so starting with 1 is a big difference from knowing nothing. Thank you, Gal.
Thank you.
David, Dudu.
Yes.
Dudu took part in the CRISPR experiment, a little bit of some more basic science. You guys started from the call for proposals, as you said. You had something before that was not space-related and kept on going from there. How was that?
That was great, but I have to say, as you said, we were clueless about space. So we knew our system very well. We're working on a CRISPR-based system, and CRISPR is used for genome editing. It won the Chemistry Nobel Prize 2 years ago for that. But we had zero experience in space. So for example, at the beginning, we thought of sending it as a dry powder, and then people says, you don't want dry powder in the International Space Station. And even just the experiment, we did like 2 simple experiments, like Eitan had to pipette these little wells. I'm sure you remember them well. And we say, well, these are fairly simple experiments to do, right? And then there was a panel in Tel Aviv that shows all the experiments and what Eitan has to do in each one of them. And then I said, oh, this is more complicated than we thought. But basically what we did is test this CRISPR system that is very sensitive to detect DNA, and we tested a few components, briefly how you amplify the DNA in space, how you detect it, and then we wanted to see how low we can go, how little DNA we can identify. And we had Eitan do it in 2 long sessions in the International Space Station, and a week later, the exact same experiments were done in the US with the same plates that were sent to the US to make sure they were under the same conditions by 2 very experienced PhDs. And I don't have a slide, but if I would show you the results, you wouldn't be able to see which was Eitan and which was the others. So this was amazing results for us. And
I think even though you planned a more complicated experiment for Eitan, as opposed to the kits that you are planning on using in clinical use.
Oh, for sure. I mean, I said it's a very simple technology, but Eitan didn't know anything simpler because we didn't even kit. We just let him test all the different stages. And since we had only 1 shot, he did many repeats of each one of the experiment. And the bottom line with the detection was that we were able to identify 8 molecules of DNA within 100 microliters, so it was really very sensitive.
Amazing. I think you also shared with me before the uses for this technology, the CRISPR technology, which is not only medical, it's only, you shared with me and I found it fascinating, when exporting agriculture or good fruit from Israel, to be sent out, they are stopped before shipped out and tested for bacteria and such, and that delays the amazing fruit from coming so fresh abroad. And with your kits, things will change, hopefully.
Yeah, so this is a project that we did with the Volcan Institute with Gur Pines is here, and this is actually he's leading that project. And he did part of what the Volcan Institute do is try to help in these fronts of also exporting goods. And he does this test especially for pests, so fly pests that the Europeans are really anxious about not getting there for good reasons.
Right.
Yeah, and indeed it can save a lot of goods for farmers in Israel, and that's.
So it's actually a technology that is significant on Earth already and has a meaningful impact here, and it has been proved now that it can work in space, and especially for long mission flights, it can make a change too.
Exactly. We're thinking about the health of the astronaut, and you say crops, so we're also thinking when we grow potatoes on Mars, like we saw in The Martian, so you also want to know if they have any viruses, and this
and
would
probably
be
they will have some special viruses we never heard about
I sure
at some
hope
point.
not.
I think also in the astronaut's busy schedule, which was full of work, I really have a vivid memory of the video when Eitan, it's like in a Zen mode, pouring in each well with the pipette. You say pipette? Yeah. One drop in each one, and he was like totally calm. Was that the situation when he did it too?
Not here. We were very anxious. It was also reporting each time, so it was Alpha 11 to Bravo 11, Alpha 11 to Alpha 12 to Bravo 12. And one time it was like the wrong one, and we were all, now we didn't have direct connection with Eitan, but one was the one and immediately cut it up, but we had like a small heart attack. And at the end of the experiment, I should note that Eitan let our plate float in the air.
Because it's beautiful.
It was beautiful, very photogenic. We were all having a heart attack back in Israel. My PhD student was, that's my PhD going on. What is he doing? But as I said, the results were amazing, and the photos were great too, so.
Good job.
Thanks for that.
I didn't see him tonight, but I wasn't here very early, but I think it is a good opportunity to say that Dr. Eliran Chemo was very involved in the CRISPR experiment, and he was very significant in all the Rakia Mission, and I want to give him a big thank you, even though he's not here on the stage. Here. Okay, Harel, from the Sheba Arc Space Innovation Center. And I'm from the Sheba Hospital too, as I said, from the pediatric ward. And I think there was something very unique from this medical center to send 6 experiments with Rakia. Because Sheba Medical Center has an Arc Space Lab inside the hospital and facilitating a lot of small projects that can fall very easily with all the dynamic changes that spaceflight has, was the biggest advantage of a big center, hosting all these small projects, small but significant, as we said before. So why? Why would a hospital do such a thing, and what's the added value of doing?
What a great question. I'm not sure I'll be able to answer, but our vision in ARC is to shape the future of health, to provide better care for everybody, basically. And it means a lot of effort and blood, sweat, and tears, which I was blessed and honored to accompany during the execution of the clinical studies of the Rakia mission. So the ARC Space Lab visions is to harness the potential of new space to advance healthcare innovation in general. And while the contribution of space to medicine, to healthcare in general is tremendous, we are very excited about three promises and benefits of space that resonate our mission. And I won't be able, unfortunately, to speak about all of our 6 clinical studies for obvious reasons, but I'll try to give examples for each promise and how we were able to demonstrate it. So in our opinion, or in our eyes, the first value is to demonstrate, play, and develop tools and methods to deliver care from afar. The crewed space missions are an amazing playground to provide comprehensive, preventive, focused care from afar in a way that, unfortunately, we are not able to provide for each and every of you. And as example for that, a very cool device that is being developed in Tel Aviv University and at Sheba Medical Center can execute blood tests non-invasively in real time. The VI device that the inventors of are sitting among you guys can spare the needle, spare the lab, and provide maybe the most critical test that we are using in our clinical routines, daily routines, even without resources. The promise of such technologies to facilitate and support deep space exploration missions is incredible, but not least the sparing of the needle for our day-to-day tests and ability to deliver care without a nearby expensive lab equipment is amazing for Earth and health equity as well. So that's one. The second
Absolutely.
thing...
I want one for my ward, please.
Of course. The ability to refer to the microgravity environment as a resource is igniting our minds, and we are one of the first groups who are looking at the effect of microgravity as a feature and not as a bug, and we tested the ways to treat Alzheimer's in space. And just like Michelle mentioned, it's holding amazing opportunities. And last but not least, but the ability to collaborate with incredible researchers and groups from here and internationally is an amazing opportunity that we are so glad to have, and what an exciting mission.
You said it very shortly, but I want to just take a few more seconds on that topic. You said using microgravity as a resource. And when we were talking before, you talked about the Dead Sea, for example. People from all over the world would come to the Dead Sea if they have psoriasis for their skin care and helping them resolve or making the situation better. And I think dreaming big and dreaming far is really looking at microgravity as a potential place for treatment, and not only just to explore something and to see if that astronauts like it or if it can help a specific situation, but actually have a safe place for specific diseases.
I will add an accessible way.
One day.
Not only one day, hopefully.
Thank you, Harel. Yair. Yair Levy from Brain.space, as I said, co-founder and CEO. That part of their experiment was actually conducted from the lowest place on the crust on Earth, where they had a researcher in the Dead Sea, a vacation at the time, who was online with the ISS with his experiment being conducted.
So, as we see today, failures can happen even here on ground. And I would like to touch base 2 points. First, Gal, you mentioned the patience of the astronauts. I would like to add curiosity. And on the second round of the experiments, we had about 12. Eitan decided to do something different. And he flipped over during the cognitive test. And lucky for his curiosity, of course, in zero gravity, there's no impact of doing that upside down. It's not like in cartoons that you're falling. And we added another proof for our experiment. We proved that that a device can be accessible for brain monitoring, but also doing that upside down. So thank you, Eitan, for your curiosity and of course, for the dedication of the entire team. Thank you very much. And coming back to the story about that, so yes, failures happened, and we had a communication failure with the headset on the third day, and we have another 5 days to run the experiment, and it was horrible. We spent 9 months, and again, we are a startup company with 11 people, fully dedicated for the mission. We managed to pass all the 9 stages of Harel in order to reach the successful launch, and even to pass the upside down experiment of Eitan. And then on the third day, a failure happened, and my team leader, Amir, who is sitting here, who was the responsible guy for the technology, is on vacation. And he's in the lowest place on Earth. And of course, luckily, and you know the end, luckily, he managed to communicate with the International Space Station, actually from the bottom of Earth up to the stars on the highest point where people were at that point. We managed to solve the problem, and of course, to comply with a very successful experiment. So thank you very much, guys.
Thank you, Yair. I think your story is quite unique, even though we do have a few partners that are companies, but having a startup company that obviously calculates very well its resources, its time, its human resources, and you didn't start as a space company, am I right? And diving into this world and taking this whole startup company, which is not huge, right? You're 11 people, and shifting it all for this project. Was it worth the round? Time will tell.
So we proved 3 points. First and most, we proved that brain sensei can work in any environment, and it's an accessible device. And coming back to Michelle's presentation, accessibility is one of the key factors in medicine in space. Second, once space travel will become common, an astronaut will need to have a monitoring device along the travel. BrainSpace has already proved that it has a validated solution. And last but not least, my team, my dedicated team, proved themselves. There is no dream beyond reach.
Another amen. That's another device I'm ordering for the pediatric ward. No more glue. Hello. Efrat, do you think you will continue? I think maybe something in Rakia project, AX1 project, mission, and Schneider is using the curiosity it enlightens in eyes of people. And I was wondering if, as a hospital also, if you think you will continue some sort of collaboration.
Yeah, so I think that when we talk about innovation in pediatrics and in children, when you look at the healthcare world, about 90% of investments are going to the adult world. So when we talk about innovation at Schneider's, we know that a spot like this should turn in a very small angle towards the children. And that is because all of us were once children. And many children that did not survive 30 or 40 years ago today, when we are in the new technologies, are young, healthy adults, just like Michal. So, yes, of course, we need to look at pediatric care, not only because it's a very large part of population around the world, and especially in Israel, but because our responsibility at Schneider's is not just taking care of the children of today that are ill, but making sure that the healthy children of today become the healthy adults of tomorrow. And for that reason, we need to research more, to do a lot more of prevention, detection, and treatment of the children of today. Definitely, this is what we're going to do, and this is what we're doing today when we talk about innovation in pediatric care.
Amazing. Thank you. I feel like we need to continue this at my place because our time is done and I have so many more questions. I want to thank you all for coming and for having long conversations before this panel and sharing your thoughts with all this audience. So thank you.
Thank you. Thank you.
Here it works? Okay. So one last thing. We got a special request, a very touching one, from one of our partners in Rakia. We have here Trish, a Trish representative. Dorit, please come. Trish is a Translation Research Institute for Space Health, is an American space health resource institute that works with NASA to support scientific research and technologies that can keep astronauts healthy during spaceflight. The Trish director, Dorit Danoviel, is here and would like to present the crew of the Axiom 1 team with tokens of appreciation for performing the Trish-sponsored research on their flight.
Thank you, Shir, and thank you for the participants and Dorit. Thank you. Thank you for the gesture.